So we have been looking at the relationship between resilience, taken as close to the diagnosis of diabetes as possible, with future HbA1c and mental health status in patients with type 1 and 2 diabetes. When you consider two patients that arrive at your clinic with an identical HbA1c, similar clinical characteristics, it's really difficult to work out which patient is going to have better outcomes down the line. So when we start talking to our patients, we realize that some of them cope really well with change, but others do not. And diabetes is perhaps one of the biggest changes that might occur in someone's life. We therefore wondered if psychological resilience may play a role in determining their adaptation to the condition. So psychological resilience is the ability to adapt positively to life conditions, to changes and adverse events, such as the diagnosis of diabetes. We therefore used a psychological resilience survey in our patients and found that in type 1 diabetes, patients with higher resilience had better blood glucose control at 2 years duration. So 10 points higher resilience was associated with 4 millimoles per mole lower HbA1c. We didn't find this association in type 2 diabetes, but what it does mean is that we can target the patients with type 1 diabetes who have low resilience and offer them more support or a fundamentally different approach to their diabetes treatment. There are a lot of different ways in which we could tackle this discrepancy. For example, there are resiliency-based interventions which have been published in meta-analyses which do show a significant improvement. So we could target resilience directly. But it might also be that we need to focus on the mental health in this cohort of patients, and we can use the resilience score as a way of targeting our intervention. So in summary, in type 2 diabetes, we didn't find any link between resilience and their glycemic control. But in type 1 diabetes, we found a significant association, and it allows us to target future interventions and future research.